Hyperkalemic periodic paralysis, HPP, is a rare genetic condition that makes muscles suddenly become very weak or unable to move. The weakness comes in short bursts, often lasting from a few minutes to a few hours, and then the person feels normal again. Think of it like a brief power outage that affects only the muscles. HPP is caused by a change mutation in a gene that controls sodium channels in muscle cells. These channels help keep the right balance of potassium, a mineral that tells muscles when to contract. When the gene is faulty, a small rise in blood potassium hyperkalemia can trigger the muscle weakness. The mutation is usually inherited from a parent, but sometimes it can appear for the first time in a child. Typical signs include sudden, painless muscle weakness that often starts in the legs or arms. The weakness may follow activities that raise potassium, such as eating a banana, drinking fruit juice, or after intense exercise. Episodes can happen many times a year or only a few times in a lifetime. Between attacks, strength is completely normal. For example, imagine you are running a sprint and then feel your legs suddenly give way for 10 minutes, after which you can run again without any pain. Doctors diagnose HPP by asking about the pattern of attacks and any triggers, measuring blood potassium during an attack, often higher than normal, doing a genetic test to look for the specific sodium channel mutation. Treatment focuses on stopping an attack and preventing future ones. During an attack, giving a small dose of glucose, sugar, with insulin can quickly lower potassium. Long-term, some people take medicines called carbonic anhydrase inhibitors, for example acetazolamide, that help keep potassium stable. Lifestyle changes, like avoiding high potassium foods before exercise, also help. Because HPP is genetic, you cannot completely prevent it, but you can lower the chance of attacks. Keep a food diary and avoid foods that raise potassium right before intense activity. Stay well hydrated and warm up slowly before exercising. If you know you have the gene, family members can get tested early and learn the same avoidance strategies. Newer drugs called potassium-binding agents, for example Paralysis, can safely lower blood potassium and may reduce attack frequency. Gene editing techniques, CRISPR, are being explored in laboratory models to correct the faulty sodium channel gene, offering hope for a future cure. Larger registries are collecting data worldwide, helping doctors understand which triggers are most common and which treatments work best for different patients.